After how many days pregnancy can be confirmed by a urine test? After how many days pregnancy can be confirmed by a urine test? Gerald Massa, the health educator, is the name of the channel. I welcome you, my friend. If you are new here, remember to subscribe. On this channel, we talk about pregnancy tips, we talk about the ovulation calendar, and we do also give advice in regards to ultrasound scans. After how many days pregnancy can be confirmed with a urine pregnancy test? Gerald Massa, the health educator, and remember to subscribe for new videos we put out every day. In this video, we are going to talk about after how many days pregnancy can be confirmed with a urine pregnancy test. After how many days pregnancy can be confirmed by urine test. After this message, I'm coming back. Keep watching. Hello, welcome to our channel. I'm Gerald Massa, the health educator. On this channel, we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. Thanks, my friend. We shall continue with our topic for today. After how many days pregnancy can be confirmed by urine test? We shall begin by defining what a pregnancy test is. This is a test done specifically to look for the hormone which is responsible for pregnancy, the hormone that is produced when a woman gets pregnant or when conception takes place. So this hormone is known as the HCG hormone, also known as the human chorionic gonadotropin hormone. So what happens is that when a pregnant woman does this test, or when fertilization has taken place, this hormone is going to be produced, and when it is produced, it can actually circulate in the body, and then it can be detected in urine. In very early pregnancy, in the early days when a woman has just got pregnant, the levels of this hormone are typically very low, and then later on as the pregnancy progresses, the levels of this hormone also keep increasing. The question is, after how many days pregnancy can be confirmed by a urine test? The most important thing we need to get here is that the release of this hormone happens gradually. It happens slowly. So if at all a woman goes ahead and she tests for pregnancy, there are two things that are going to happen. There could be errors in the first place, or there could be results being given immediately. The errors are specifically due to two things. The first thing is that it could be due to the timing, and then it could also be due to the interpretation of the results. After doing a pregnancy test, it is very important to consider timing. Timing is very, very important, because if you do the pregnancy test, maybe using whichever method is available, and then you do the test and the results show that specifically you are positive, or the pregnancy test is positive, this actually means that the test has detected, or the test has detected the HCG hormone, and normally this is 80 to 90% correct. If at all the test shows you that you are negative, or you are not pregnant, and yet inside you are feeling you're feeling changes in your body, and the test has shown you that you are not pregnant, it's always advisable to wait at least for the next 1 to 2 weeks, because probably you might have tested too early before the hormone was released. That is due to timing. The first error is due to timing. The next error could be due to interpretation. When a woman tests for pregnancy using the urine pregnancy test or the urine pregnancy test strips, what happens is that the interpretation of the results should take place within the recommended time by the manufacturer. The manufacturer of the pregnancy test strips specifically has instructions on top of the package. Make sure that you read the instructions very well, because there are some manufacturers who will put that the tests have to be interpreted within 1 minute, whereas there are some tests, or there are some manufacturers who will put and say that the results have to be interpreted within 2 minutes. So when you do the pregnancy test, make sure that you read the instructions, because when you do not read the instructions, you can end up getting results which are not correct, or we call them the false positive results or the false negative results. So the two commonest errors in pregnancy testings, or in the two common errors in pregnancy testing, are due to timing, that is one, and then the next one is due to interpretation. The timing should be according to the manufacturer. Normally, the recommended time is within 1 to 2 minutes. If you take the pregnancy test maybe early in the morning, which is the best time, and then after doing the pregnancy test, you put the strip on the side, and then you go on and do your other work of the day, and then after 2 hours or after 6 hours, you remember that you did the pregnancy test, and then come back very fast and read the results. What is going to be happening is that you are most likely to see what we call false positive or false negative results. The main reason is that the HCG hormone specifically can be interpreted within the recommended time according to how the manufacturer instructed you to read the results. So what happens is that if at all you saw, if it was supposed to be a positive test, maybe the two lines have crossed, or the testing kit has shown you, because there are those which show they show the word pregnant or not pregnant. So probably the results showed at first within the 1 to 2 minutes, but because there was delay, the results actually went back to negative. So this normally happens due to evaporation. Urine tends to evaporate from the testing strip, and then of course the changes or the results will become false. The main point we need to take from here is that when you have done the pregnancy test, make sure that you read the results within 1 to 2 minutes. Failure to read the results within 1 to 2 minutes, it means the results are no longer accurate. They may give results which are wrong, and the best advice is you should at least consider repeating the test again with another testing strip or with another testing kit which is at least brand new. The next is interpretation. Make sure that you interpret the results correctly. Remember, we've said that it should be within 1 to 2 minutes, but also if you get a negative test, you've done the pregnancy test but the results come back and then it's a negative test, the best advice is that you should at least consider repeating this test after 2 weeks later on. Or you could actually also contact your doctor who will repeat the pregnancy test using other methods. Your doctor might actually request for a blood HCG pregnancy test which looks for the HCG hormone but in your blood. Or your doctor could also order what we call a pelvic ultrasound scan, which can actually show changes on your uterine lining, also known as the endometrium. If at all it becomes thickened and then it increases in its size, the inside of your womb, if it is thickened, and it is actually hyperechoic. Hyperechoic is a term normally used by doctors of ultrasound. Your doctor will give a result that yes, there are changes of implantation or there are changes of pregnancy happening in your womb. The question is, after how many days pregnancy can be confirmed by a urine test? After how many days pregnancy can be confirmed by a urine test? So To answer this question, having talked about the pregnancy tests, we need to understand that after ovulation has taken place, and maybe you did the timing, we've been talking about ovulation. You can, if you missed our topics about ovulation, there are lots of videos on our channel. Go to our video library and then look at the videos talking about ovulation. Ovulation is the release of the egg on the 14th day. Please, if you missed our videos, if you're new here, remember to subscribe and go to our video library and then look at our videos. We've been talking about ovulation. So, to answer this question, after how many days pregnancy can be confirmed by a urine test, simply you need to take this point home and say that if at all ovulation has happened, and maybe you were calculating your ovulation days very well, and then you had sex with your partner on the ovulation day, or you actually after ovulation, or after you've been with your partner, there are some tests which are so sensitive that they can detect even the slightest amount of HCG in your urine. But the best amount of days, the best number of days to test for pregnancy is at least 12 to 14 days after conception, or 12 to 14 days after you have missed your periods. If you miss your periods, at least wait for 12 to 14 days and then do the test. You could do the test earlier on, but remember there are chances that you could end up with results which are not so conclusive. For example, you could end up with a negative test, but yet you are actually pregnant, but maybe you tested too early. So what you need to take home from this video is that always the best time to test for pregnancy is when you have missed your period. When you have missed your period, then just make sure that you wait for at least 12 to 14 days and then you do the test. Or the signs and symptoms of a twin pregnancy. Twin baby pregnancy symptoms. Conceiving twins is our lesson for today. We are going to look at what are the signs and symptoms that you are pregnant with twins. Gerald Massa, the health educator, is the name of the channel. We are talking about the signs and symptoms of a twin pregnancy. Are you pregnant? Do you suspect that you could be carrying twins? Then this video is for you. Keep watching. After this short message, I'm coming back and we are going to talk about the signs and symptoms of a twin pregnancy. Thank you. Thanks a lot, my friend, for staying around, for watching our video for today. And by the end of this video, you are going to be knowing all the signs and symptoms of a twin pregnancy. Gerald Massa, the health educator, is the name of the channel, and I welcome you, my friend. If you are new here, remember to hit the subscribe button, click the subscribe button so that you get new videos we put out every day. On this channel, we talk about women's health, we talk about fertility, ovulation calculator. We do also give pregnancy tips. Subscribe so that you get new videos every day at exactly 17 hours East African time. So without further ado, we should talk about this very important point, that it's only an ultrasound scan that can confirm that you are carrying twins. It is the best way to confirm that you could be carrying twins, but still there are other signs and symptoms which are very important, and they can also help us tell whether you are pregnant with twins or you are carrying a single baby. So what is happening is that some mothers who are pregnant with twins say that they suspect they could be carrying twins, but still they may be having some signs and symptoms. But the truth is that while there are several signs and symptoms of a twin pregnancy, there's also tremendous overlap with the signs and symptoms of a singleton pregnancy. A singleton pregnancy is a type of pregnancy where you are having a single baby or a single fetus. It is impossible to definitely know whether you are carrying twins or multiple babies by simply gauging how you feel or going off of what a home pregnancy test shows. So you cannot do the home pregnancy test with the urine HCG test and then say that you are carrying twins. No, you are going to get results still you will get the positive results, but this is not a conclusive way of telling that you could be carrying a twin pregnancy. So we shall go to the first sign and symptom of a twin pregnancy, and this is more morning sickness. There's a saying about twins that twice is really much. Twice is really much. So what is happening is that if at all you are carrying more than one baby, then if at all at first you are pregnant with one baby, you will get morning sickness. But imagine if you are carrying two babies. If you are carrying two babies or even 3 babies, then the morning sickness is going to be more. So the first sign that you could be carrying a twin pregnancy is that your morning sickness will be increased. The morning sickness will be a lot. So if you are a woman out there and you are pregnant and your morning sickness, the morning sickness is much as they call it morning sickness, but it is basically that feeling of weakness, that feeling of you're tired, and it can actually come throughout the day. Though they call it morning sickness, but it can actually happen throughout the whole day. But in twin pregnancies, it is going to be much. It is going to be increased. So the first sign that you could be carrying twins is that your morning sickness will be doubled. Next sign of carrying twins, next sign that you could be carrying twins is elevated beta HCG levels. Your beta HCG levels will be elevated, and remember, when we talk about HCG, basically we are talking about the human chorionic gonadotropin hormone. This is the hormone that is released when a woman gets pregnant. It is released by the placenta. It is also released by the corpus luteum, in early pregnancies when fertilization has just taken place. But when the fetus has implanted, or when the baby has implanted onto your womb, then the placenta begins producing the HCG, plus other parts of the body also they could also produce the HCG. So the levels of the HCG are going to be doubled. You cannot conclusively distinguish a single pregnancy from twins on a urine pregnancy test, but still when you do the blood HCG test, the levels are going to be increased. They are going to be doubled. Next pregnancy symptom is that there's going to be severe fatigue. We talked about the morning sickness being doubled. So the next sign that you could be carrying a twin pregnancy is that you are going to be having severe fatigue. Extreme fatigue is the most commonly reported complaint during pregnancy with multiples. So if you are a pregnant mother and you are experiencing extreme fatigue, then there are high chances that you could be actually carrying twins. In some cases, the fatigue can be attributed to other factors, and these include stress, work, and then also poor nutrition, not feeding well, and then having other children you are taking care of. Then still, this means that you could be overworked. But if at all you are pregnant and you are having extreme fatigue, then it is basically very important that you go ahead and talk to your doctor, who will request for some tests to be done, some tests to be performed on you. Another point we need to take is that fatigue is rather a subjective symptom and has many other causes. If at all you are pregnant and you are fatigued, you feel tired a lot, please consider talking to your doctor, who will order some tests. These tests may include a CBC or a complete blood count. Here, a whole check will be done on your blood cells, whereby your doctor will look at your white blood cells, the white blood cell count, the red blood cell count, and then also your platelets. Any abnormalities, any deviations from the normal, then this could actually mean that you could be having another cause or something else causing the fatigue. For example, low hemoglobin levels or having low HB levels. Still, this can be managed if at all it has been identified. If you are pregnant and you are having extreme fatigue, please talk to your doctor so that some tests may be done. If you are in the tropics, like in Africa, this could be, the extreme fatigue could be due to malaria. It could also be due to infection. Next, pregnancy symptom to confirm that you could be carrying twins is abnormal AFP test results. Abnormal AFP test results. When we talk about the AFP, we are talking about the alpha fetoprotein. Alpha fetoprotein is a blood test performed on pregnant mothers during the second trimester. Alpha fetoprotein is a blood test performed on pregnant mothers during the second trimester. It's also known as maternal serum screening or multiple marker screening. It is used to identify increased risks of certain birth defects. So if you are pregnant and your levels of the AFP, that is the alpha fetoprotein, is really high, then you could be actually carrying twins. But remember, the alpha fetoprotein test is used to detect increased chances of getting birth defects. So a twin pregnancy can produce an unusually high or positive result. Still, when you do this alpha fetoprotein test, which is used to detect birth defects, but if you do this test in your hospital or in a nearby hospital or health facility and the results turn out to be positive, please consider talking to your doctor. This could be a sign, this could be a symptom of a twin pregnancy. If you do this and then you go ahead and do the obstetric ultrasound scan or the pelvic ultrasound scan, and it turns out and it shows that you are pregnant with one baby, but you have an abnormally high alpha fetoprotein test, then please you need to repeat the ultrasound scan, and your sonographer or your doctor doing the scan should really pay more close attention, because the baby could be having some birth defects. For example, birth defects including cardiac issues or defects of the nervous system, like for example the spina bifida. So whenever you are pregnant and you have an abnormally high alpha fetoprotein test, then it is very important that you go ahead and talk to your doctor. Next pregnancy symptom to really tell us that you could be pregnant with twins. Next symptom is that you'll be measuring large. Throughout your pregnancy, your doctor or midwife will measure the height of your uterine fundus, measuring from the top of your pubic bone to the top of the uterus. To measure the uterine fundus, measurements are done from the top of your pubic bone. The pubic bone is specifically that bone in your pelvis up to the top of your uterus, that is around your umbilicus or your umbilical cord. This is a method by which estimation of the gestational age is done, but still, if at all the results come out and they are not conclusive, then your doctor or your midwife will request for an ultrasound scan. A twin or multiple pregnancy may cause the mother's uterus to expand beyond the range of a single pregnancy. However, other factors may also increase the measurements. This measurement is more difficult in earlier pregnancies or when the pregnancy is in the early stages, whereby your midwife will basically record that the pregnancy is palatable or it is basically palpable. But later on, as the baby is growing, this measurement is very, very key. It can actually give us a clue, because if at all the measurements for the expected age, if the baby is expected to be 20 weeks, but your measurements are way much more higher, then you could be actually carrying twins. You need to confirm with your doctor you could be carrying twins. Next pregnancy symptom to confirm that you could be carrying twins is fetal movements will be increased. Feeling a baby or babies move inside your womb is one of the most thrilling factors of pregnancy. This is also known as quickening, or the time at which you first feel your baby. This occurs between 18 up to 25 weeks. This is basically in the third and the fourth trimester, but it can also, it actually begins in the third and the fourth trimester. This is between 18 to 25 weeks, but is usually detected earlier on in subsequent pregnancies as early as 16 weeks. When women feel movement in early pregnancy, this is normally, actually it is a sign to show that the baby is well, to show that the baby is okay. But when the movements increase, then it could actually be an indication that you could be pregnant with twins. Next pregnancy symptom to confirm that you could be carrying twins is there's weight gain. While mothers of twins only gain about 10 pounds more than singleton mothers, the amount of weight a woman gains often depends on her height, the body type, and how much she weighed before the pregnancy. So much of the increase in weight gain occurs later on in pregnancy, often after an ultrasound has already confirmed or excluded a diagnosis of twins or multiple babies. So weight gain is one of the signs and symptoms that you could be carrying a twin pregnancy. In twin pregnancies, your weight will actually double. Gut feelings and hunches is our next pregnancy symptom to really tell us that you could be carrying a twin pregnancy, while the other types in this list refer to some kind of visible evidence. Exaggerated symptoms, abnormal test results, increased morning sickness, and more can also be used to really say that you could be carrying a twin pregnancy. Lastly, the most important point we are taking home from this video is that you should do what we call ultrasound scanning. Seeing is believing. The only way to confirm that you could be or you are carrying twins is by doing an ultrasound scan. Specifically, you do what we call a pelvic or obstetric ultrasound scanning, though in most cases your doctor will opt for an obstetric ultrasound scanning because it is much more precise, it's much more on point. It is very unlikely that an ultrasound scan would miss an additional baby. At least an ultrasound scan can show that yes, there's a second baby somewhere. However, there have been cases of hidden twins. In particular, a hidden twin is more likely on an early ultrasound scan than when the baby is actually much more grown. Thanks a lot, my friend, for watching today's lesson. By the end of this lesson, I hope you've learned the signs and symptoms that you could be carrying a twin pregnancy. And yes, if you have any questions, ask me all your questions down below in the comments. I will be very happy to answer all your questions. Remember, the signs and symptoms that you could be carrying a twin pregnancy is that there's increased fatigue, there's increased morning sickness, there's elevated beta HCG levels, there's increased alpha fetoprotein levels, there's severe fatigue, and then also the movements will be increased, and then there are also other things which can be detected, but still what you need to do is you should do an ultrasound scan to go ahead and confirm that yes, this is a twin pregnancy. Gerald Massa, the health educator, is the name of the channel. I thank you, my friend, for watching today's lesson. Remember to subscribe for new videos we release every day. Like, share, and hit the bell for notifications so that YouTube will show you the new videos we put out every day, the new videos we release every day. On this channel, we talk about pregnancy, we talk about the ovulation calendar, we do talk about women's health. Have yourself a fantastic and healthy day. May God bless us all, and see you in my next video tomorrow at exactly 17 hours. Bye bye, take care, God bless, bye. Hello, welcome to our channel. I'm Gerald Massa, the health educator. On this channel we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome.
could even go for the test at least 6 to 8 days after you have missed your periods. The key is make sure that you first miss your periods and then do the test. Otherwise, the excitement and everything can bring about you doing the test very early and then ending up with results which are not really conclusive. Gerald Massa, the health educator, is the name of the channel. I thank you, my friend, for joining me for today's lesson. After how many days pregnancy can be confirmed? Remember to connect with me down below in the comments if you have any questions.
read the messages in the description. And then also you could also connect with me on my WhatsApp. Submit your questions. I will answer all your questions. Gerald Massa, the health educator. On this channel, we talk about the ovulation calendar. We talk about the ovulation calculator, and then also we give pregnancy tips. Remember to subscribe for new videos we put out every day. Thank you, my friend, for joining me. I hope you've got at least something from this message. After how many days pregnancy can be confirmed? The best time is 12 to 14 days after conception, or at least you wait until you miss your periods and then you can do the pregnancy test. Have yourself a fantastic and healthy day. May God bless and protect us all. May God bless and protect us all. See you in my next video, and remember to check our description for details. Have yourself a fantastic day, and bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerald Massa, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye.